Hello, it's Dr. Troy here from Zenaptic Chiropractic, and I see a lot of patients who have headaches, neck pain, they'll have numbness and tingling in their hands, they'll have disc issues, disc bulges, hernias, and one of the great ways to see if we can help reduce that suffering and the pressure that's on those soft tissues is through a cervical traction unit. This is one of the things that we prescribe for many of our patients. This unit is something you can hang at home on the wall. You can get an eye bolt, screw it into the wall. It's got an attachment here that can hook over the door, so you can put it on the door, close the door, and then you do your traction. So I'll demonstrate how we do the traction in our office. These are adjustable, so if you're the only one or you have a couple family members, the cheapest thing is to put an eye bolt in the wall and then set the traction for your height. So we recommend that the traction unit should be about shoulder height when it's set up, so your hands are going to be here, and this goes behind the head, and the whole goal here is to try to reestablish that cervical curve. The U.S. cycling team found if they position their riders on the cycle with a 45-degree curve, they're going to get maximum lung function. And that's important for cycling, so it's important for people who sit at desks and do all that, like most of us commoners, not elite athletes. But extend the head as far as we can. None of this should hurt, shouldn't be painful. If it's painful, you're going too hard. I see a lot of motor vehicle accidents. They have fresh injuries. Their soft tissues are very sensitive. So we're just going to extend back as far as we can, and then we're going to bring that to the chin. So the whole goal is to extend your head back, and then we're going to traction up this way. So you slightly bend your knees, come down, and hold. And many times you'll hear a popping sound in the neck, you'll hear gas releasing, but we hold for 5 seconds, 1, 2, 3, 4, 5, and then we come up, and then come back down and hold. And usually I'll have the patients take a deep breath, and they come down, and then out. So they're opening that lung volume and out. So what this does is the discs are, the longer you stand in gravity, the discs are going to squish together and the water is going to come out of them, kind of like a sponge. So the theory behind this is we're opening up those discs and we're tractioning them to the normal spinal curve. So that's going to bring nutrients in. It's going to help puff up the disc. So if there's foraminal, where the nerves come out of the spine, if there's foraminal compression, it's going to help open that up. Helps tremendously with shoulder problems, headaches, neck pain, upper back pain, carpal tunnel issues, elbow pain. This is a great tool. I can't strongly suggest this enough. This is something you can get in our office. We can mail you one. We have them on our website. There's a ton of videos about this on there. There's a lot of great health benefits, especially for people now with texting, computers, driving, sitting on a couch, watching TV. We tend to bring our head forward like this. It accelerates the degeneration in our neck and the breakdown of our spine, and ultimately it's going to affect our health. So this is Dr. Troy talking about the cervical traction. If you're interested in one, call our office, or if you have some issues that you want some help with, free consultation for anybody who calls and said, I saw you online. This is Dr. Troy, 360-260-6903.